Why, hello, greetings. How do you do? Thank you for joining me. We are here, as we often are at this time, for a live Q&A session. And if you are here with me live, you can certainly feel free to put any comments or questions down below. I will be able to respond to you, and we can even have a dialogue back and forth. Or if you're watching this as a replay sometime in the future, same thing, put in your comments or questions, and I will carry those forward to a future call. So yeah, today to start with, I do have a topic that's I've been thinking about this week. It's kind of as a result of the various conversations I've had with patients this week, and it's kind of crystallized into my first topic today. And it's really on what I'm calling the problem in healthcare of anti-diagnosis. So, okay, so we, of course, we all know the word diagnosis, but what do I mean by anti-diagnosis? And I guess the simple way of defining that is the way that diagnosis is done improperly, in so many contexts, both in allopathic medicine and much of naturopathic medicine, you get these anti-diagnoses. So what I mean in that specific case, I'm kind of playing with words a little bit. It's like, what, am I just a rebel? I want to call everything anti. Well, no, I have a very specific meaning here. And in my purpose, in my sense, what I'm talking about is how the diagnosis, or what the patient is wanting for, looking for in a diagnosis, is supposed to help them, right? It's supposed to not only give them clarity, but also a solution. Well, in my meaning, in my sense of anti-diagnosis, and I'll give you an example in a moment, is you're really getting something that is blocking the patient from making proper progress in their healthcare, right? You get any number of these standard condition labels. Somebody has allergy-based asthma, or somebody has certain liver dysfunction, or somebody has a certain heart disorder, or arrhythmia in the heart, or whatever. All these different labels, they sound impressive, they sound helpful, they sound like you're helping the patient get somewhere. But as I'm saying, it's the opposite. It's an anti-diagnosis, and it's actually putting a blockage to the patient making the progress that we would all like them to see. So, and the reason for that, the reason why I'm saying that, is because when you get such a label, it's by and large, most of those labels, as I say, they sound good, they sound impressive, and they sound well. They've made their place in the textbook and everything. And even these diseases that are named after people, like Lou Gehrig's disease or something like that. Oh, it has a famous name, and it's attached to a person, a famous person. And so anyways, it takes on this whole aura, and the way the whole medical profession kind of emphasizes all these labels. But as I'm saying, it kind of blocks healthcare, because it doesn't, first of all, it's not giving you the really, what we want, the really individualized reasons for what's going on in a person, what's really caused their set of symptoms, right? If when we start talking about real causes, that's when we get into true diagnosis. But when we're talking about these generic labels, they could apply to a million different people, and it doesn't really take you down the path of treatment in the way we want to. So as I say, we want to look at the real causes. We want to look at the individual shape of things, what's going on in that individual case. And when we get to that level, we don't even use generic labels anymore, right? When we get into the real Heilkunst diagnosis, we're using very specific, discernible impairments or dysfunction to their life function, which we name in very specific ways, around when we're looking at certain homeopathic remedies to be used, and what's actually going to unblock step by step what's going on in their case. That's where we're getting into a true diagnosis, and therefore a true treatment. So anyways, all this to say is, from various conversations that I had this week, this kind of came to the forefront of my mind, is that, yeah, we need to get, like, not only do we need to be as specific as we are in Heilkunst, but I think we need to do a lot of myth busting, as it were, about how the allopathic and naturopathic world kind of uses all of these, what I'm calling anti-diagnoses, or these kind of false condition labels. So they do way more harm than good. And if and just, because most people don't know any better, most people don't have a medical education. They just go to a doctor, for whatever their health problem is. But yeah, at some more basic level, we need a better kind of public education going on about true diagnosis versus what I'm calling here is anti-diagnosis. So yeah, as soon as you hear any of those standard labels, or of course, then they invent new ones, right? It's like, oh, we have a new condition now, and they're going to give it a new name. Well, it's this. It's just the same old, same old. Like, they're not getting to any true diagnosis. They're not really uncovering anything new and real as far as healthcare goes, but they're just kind of inventing a new label to, well, to do whatever, try to impress people, try to make it sound like, they know what they're talking about, but it's all a great big smoke screen. So as I say, as soon as you hear anything that was one of these generic labels being applied to you or a family member or whatever, be very, very, very cautious about what you do, because of course in the allopathic system, and then even in the naturopathic, then you get into a whole formulaic way of approaching that supposed condition. Oh, well, you need this drug, or then go do here and do this, and da 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 da. You're just off to the formulaic races. But as I said at the beginning, it's an anti-diagnosis, and it leads to kind of very bad treatment outcomes. Right? You're not getting to cure. You're not getting into actually uprooting the true causes of the case, but you're just kind of shuffling around the symptoms. As I've talked about in other videos, you end up with suppression, not curing the disease, but actually suppressing it, and you just end up with someone in kind of a worse place than where they started out with. So, anyways, you take your anti-diagnosis, you take your anti-treatment, and yeah, you do not end up with a very good outcome from that. So that's just my basic first topic I wanted to talk about today. As I said, if you are here with me live, I will be happy to take any questions on this specific topic or on anything, right? If you any other health things or health questions that you have, you can type them into the comment box. Likewise, if you're here later on watching a replay, you can put in your questions, and I will bring that forward to the future. But otherwise, yeah, I will just leave this window open for about a minute, because I know there is a time delay between when I'm here talking to the camera and when it actually kind of hits the live stream out there. So I'll leave you about a minute if you're typing a question, and otherwise I will see you in the next stream.